Hello, everybody. This is Will Moyer. So we've got two exciting half-hour talks here today. One is the orientation to the NINDS Clinical Trials Methodology course. This is in distinction. We gave a bit of an overview of it before you all applied, and going to try to quickly go through these things and answer your questions, and then we're going to do another power webinar on asking a good clinical trial research question in the early phase. All right. So here are our course directors, Dr. Roger Lewis, who's an emergency physician at Harbor UCLA Medical Center, Dr. Lori Gutman, who's the vice chair of research at the Department of Neurology at the University of Iowa, Dr. Robin Conwit, who is the program director in the clinical trials division at NINDS, Chris Coffey, who's professor of biostatistics and director of the NeuroNext DCC at the University of Iowa, and then me in the departments of emergency medicine and neurology at the University of Michigan. But we're not really the people who get stuff done. First, I would like to recognize Lisa Garnes. She is my administrative assistant, and she will help you book travel so that you get to the right place at the right time. And then, of course, you've heard from Joy Black, who's the project manager. And I apologize that I found a pixelated picture, but that's what I found. So to review, the goals of the course are to identify promising investigators in the clinical neurosciences and provide them with a rigorous foundation, design, funding, conduct, monitoring, oversight, and ethical performance of patient-oriented clinical research. And we do have emphasis on clinical trials. Also, we want to promote the ongoing professional career development of you, our trainees, and also to enhance the pipeline of scientifically sound, well-designed early phase clinical trials. We had an intro to the course where we discussed a bit more of the rationale and why it's hard to do early phase clinical trials. So if you haven't seen that, I know many of you signed in for that, it is good to review. And it can be fun to play it at like double speed so that we sound like Alvin and the Chipmunks. So the timeline, we did work on scheduling and some pre-review in March. That has passed. We are now in this spring to summer phase where we are working on webinars, which we're going to be conducting one today and then oftentimes on Tuesdays at this time block. Small group meetings, which are an essential part of this course and our project-based learning strategy, and also arranging for travel and logistics so we can all get to Iowa City at the right time. Then we have the mandatory in-person experience in Iowa City, where we have additional didactics, workshops, small groups. And again, this is a mandatory part of the course experience. Then in the fall, we have more small groups and mock study sections. Our mock study sections are typically right at the beginning of November, but right now we're going to try to get out in front of an issue that some of you may have, which is if you're applying for October deadlines, particularly the AAN Career Development Award, which has an October 1 deadline. Try to let us know early, and perhaps some aspects of your proposal development can be accelerated. Again, if you could clue us and your small group leaders in on that, we may be able to do an early mock review panel for people who are on a timeline where they need to get something actually submitted in October. And that would be, again, an accelerated timeline that we could work out with you. We have many partnerships. This course was derived out of a partnership between the NeuroNext network and the NET network, the Neurologic Emergency Treatment Trials Network, which at the time in 2014 were the two existing NINDS clinical trials networks. StrokeNet was announced and funded a very similar timeline to when our course started. The Neurologic Emergency Treatment Trials Network has transformed into SIREN. While in the SIREN network, we do also look at, in addition to neurological problems for clinical trials, heart, lung, and blood trials. Our course still here focuses on neurologic problems, because that's the expertise of our faculty and the setup for our curriculum. But we do have many partnerships with biostatisticians and clinical faculty who are involved with StrokeNet. We do have a great partnership with AAN in terms of their support of our reunion every year. Oh, and I should have put the date of the reunion onto this slide. I know that Joy will be sending you invites, but the reunion is the Sunday of AAN. I believe that's May 5th, if I'm not mistaken.
That's correct.
So just keep that in mind if you'll be at AAN in Philadelphia this year. And we are continuing to work with partnerships with AAN. We have additional partnerships with the AANEM, the Neuromuscular and Electrodiagnostic Society, and additionally working to continue to collaborate with other organizations interested in doing clinical trials and clinical research. So the syllabus is basically the source of truth. We're evolving the source of truth as we get a few things finalized. This is the earliest that we've started our small groups, and we are doing that so that there can be more time for you to have some iteration in between small groups so that you can accomplish more before coming to the course. But I'm very excited that we have a bit more flexibility, and I thank you for your patience through this process. Since I all know that you can read, I'm going to just make sure that I emphasize some of the key points in the syllabus just so that you have those on your mind. So that we do have an ethics statement here. Again, we look at this experience because it's under, you're funded by NINDS and NIH, we take, ethics and academic integrity very seriously. We've not had this come up before, but obviously ideas or material presented by the trainees is, you can't use other people's stuff and intellectual property without some form of written permission. If there are any concerns about this, please talk to the course leadership. If you have any other specific issues where you need to have things be a little bit more discreet for some reason because of a relationship with industry, that's fine. Just talk to us and we can certainly figure out ways to work around this. We have never had a problem in this area that I'm aware of, so I'm sure we will keep it that way. So reviewing some of the high points from our syllabus. So blue jeans, if you are watching this right now on April 16th at noon Eastern, you made it, you figured out how to log into blue jeans. Particularly for the small group sessions, we want you to really try to use your webcams. We want people to get to know each other in the small groups ahead of time, and this, we think, promotes engagement and being present, as opposed to looking at emails and things like that. Not that I've ever done that on a conference call. But, again, we have small groups with really engaged faculty, and people are really interested in helping your ideas develop. If you're having a bad connection, there's a settings button, and that allows blue jeans to call over the phone if the internet is slow. But you should never call separately and have it on your computer at the same time. That leads to a feedback because your computer can't cancel, your phone can't cancel the noise that's coming out of your computer properly, and it leads to a wonderful feedback. And you can get around this if you selected screen share only when logging into the computer. There are iOS and Android apps for tablets and phones. So mBox, which is also known as Box, but Michigan, we try to put an M in front of everything, is for file sharing. It's possible your institution has an institutional Box account, in which case the folder, your login will likely be through your institution after you're invited to a folder, and it sort of maps into your mBox space, and you can sync that folder or do whatever you normally do with mBox. If your institution doesn't use it, you can get what's called a umich friend account, and that allows for you to log into the box from Michigan. We will post recordings of your small group sessions there that if you want to review later are available to you. We don't post small groups to the public internet. but we do post these webinars to the to the internet broadly because this is a open educational resource that we want to make sure others can use even if they're not in the project-based learning part of the course. We use Qualtrics, which is similar to SurveyMonkey. It's a software that allows us to collect information. If you've applied to the course, you've successfully used it before. And since you're here, many of you, I think, have applied to the course and been accepted. We use it for evaluation, small group webinars, and course evaluations. We will potentially be using something slightly different for outcome evaluations, which is evaluating how long it takes you to get a project going or get an NIH grant or get involved in clinical trials. These are the webinars. We're working on finalizing some of the times of these and making sure we have this really close, but just to get a sense, trying to have them every couple weeks and trying to have an emphasis on relatively early having things that you can use for your clinical trials as you're developing them. Also have the fall ones here. The fall ones are a little bit more preliminary, but I think these will be good. We rotate through some of these each year. You can see many of the ones that we've done in past years on our website. So we'll have the final presenters and stuff soon. Generally, they'll be on Tuesdays at noon Eastern, but there may be a slight deviation from that depending on the presenter's needs. So I think one of the things that is crucial to the course, and I think one of the things that makes our course unique and I think hopefully very helpful is the small group sessions. And some of our course participants over the years have given us some information about how much time needs to go into preparing for these things. We make an argument that this is time well spent in terms of getting materials done early, submitted to your faculty through Box sooner rather than later, so they have some time to look on them and reflect. We do know that life happens, and the syllabus is a aggressive schedule for protocol development, and we do use a overall strategy of developing a scientific protocol first, and then moving on to derive a proposal from that so that you really get that scientific question and the organization of the clinical trial down through developing the full protocol. For many trial mechanisms, especially at NINDS, having a full trial protocol before submission is required because oftentimes you have to submit an IND or an IDE depending on if it's a drug or device trial. So this isn't this may be different than some of the things that your mentors or others have done, and maybe different compared to other clinical research projects in which once the resources of the grant come, then the whole protocol is written. And we will have I have an example protocol that I will be sure to make sure we have linkages to so people can see what a protocol for a trial that is currently enrolling a single site trial. The main outcome is blood pressure, though, so it's not. It's a neurologic trial in as much that reducing blood pressure reduces stroke, which I think is a good thing. So it gives a good example of what all the pieces are. So for these small group sessions, again, there's an aggressive timeline to get through a number of tasks to build out the protocol. Now, some of these can benefit from the feedback of you and the small group leaders in your section. Some of them are things that you can do on your own. So we don't necessarily think that every single section of the protocol is going to be filled out through these small groups. I think we really want to make sure the small groups have at least 6 sessions. If there's time to have the more, we have some ideas for how to organize those times. Sometimes some projects do need to kind of keep working on, say, session 2 stuff, selecting the objectives and defining the endpoints. And it's okay. This isn't a race, and spending time getting the endpoints and the objectives and the concept right is okay. And we don't want you to move on if you don't have these things figured out. But on the other hand, we want to try to motivate you to make some decisions in these areas, which potentially can be adjusted so that you can continue to make forward progress. In session 4, again, looking at patient population inclusion exclusion. Session 5, looking at treatment allocation interventions. 6 kind of comes back to the measurements, exactly when, the schedule of events, what the defined primary and secondary endpoints are going to be in data management, along with some preliminary statistical analysis strategy, and the stretch sessions that if your group has time can potentially get through adverse event and data and safety monitoring. Again, what you're going to be tracking, what are going to be defined as serious adverse events, and the final statistical analysis strategy with detailed sample size and so forth. And again, some of these things may be things that you're finalizing at the course, the residential course, and that is okay. We want to, we don't want to scare you, and we don't want to have you perform at less than a level that maybe you can perform at if you're moving through things quickly. So again, it is, is certainly okay if you don't get through all of these sessions. Certainly some groups may not have the overlapping availability within all the weeks that are left to schedule 9 sessions. So that is not a problem. So the goal, though, is to come to Iowa City and have a protocol that is drafted. It is okay if not all of those sections will be finalized. We do have a protocol template. The protocol template is a bit oriented towards phase 2/3 drug studies, but a lot of the sections are potentially relevant for a wide variety of trials. Potentially other protocol templates could be used if you find them. If you have a sort of non-pharmacologic intervention and a really good prior study was done and their protocol is published, you could perhaps use elements from that. So it's not meant to be a dogmatic use this protocol or else, but it's good because it keeps track of a lot of the things that sometimes we forget about when we're maybe just writing a plain grant submission, a lot of the details that are necessary. The residential course, this is one of our pictures on the Ped Mall in Iowa City, and the picture is not optional. It will be listed on the residential course agenda. So then in the fall, after you've really settled the scientific questions in terms of the design of the protocol, you pivot towards proposal writing. And again, for those who might be looking towards an October deadline, again, with some advance notice, we can certainly think about early submissions of the proposal and pivoting perhaps to some proposal work even while you're at the residential course, assuming you've made great progress on the protocol. This is, again, we want to be proactive this year, as opposed to, knowing that those deadlines are at those times. So the general structure of the 3 small groups that we would suggest to have in the fall are one where you focus on a major first draft of the research proposal, which perhaps for some of the sections may be outline based, but having a really good specific aims page. And we have certainly webinars from the past years that are excellent. If you're ever writing a specific aims page, watching Robert Silbergleit's webinar on specific aims that he's done for the course is something I actually try to watch before I try to complete a specific aims page or revise one. Session 11 will be the proposal sections, kind of the significance with an emphasis on the scientific premise. What is the underlying evidence for what you are trying to do? The innovation and approach with an emphasis on rigor and transparency in approach. The human subjects protection sections, and then the other parts, Form E, if you're submitting a clinical trial to NIH, does have a lot of other sections that describe the clinical trial that are new in the new application process. And then session 12 to kind of finalize and wrap up the proposal, additional sections as completed. I think I have a next slide that is, if you're not applying to NIH, you can kind of include a cover letter and show us what the required elements are. We will review those sorts of grants. A lot of our review through the mock study section is focused on approach, so that's where the majority of the feedback is going to be. Obviously, if you're applying to a career development award, depending on the faculty's level of comfort with that, they can certainly give you some advice on those sections. But really, we're making sure that the scientific idea, the premise behind your idea, and the approach are well grounded in what you have submitted. We want you to have most of the elements of your grant proposal, but again, our review is going to focus on the approach. You can't submit a protocol as a research plan because the structure of a grant proposal is always different from a protocol. And we want these in by October 15th, but again, if you have an earlier deadline and want to work off an alternative deadline, start to let us know now. I know we've collected some of that from you at the application process, and we'll be thinking about that, but sometimes people have changes in terms of what they're planning versus what they end up doing. So new this year, we're hoping to get, we've in the past invited people to observe the mock study section, which is different obviously from how peer review works in real life. But this year we actually want you to think like a reviewer, and we're going to give you some instructions for reading the instructions and watching the videos for training for NIH review panels, and actually have you serve on the mock study section and potentially review other people's proposals. So that was suggested by one of the trainees last year, and I thought it was a brilliant idea. I think we will see how that goes, but that's something that to put on the radar. We'll be sending dates for those once we start to get a sense as to who's going to be getting proposals in. If if you're unable to get a proposal in by the October 15th deadline, we may be able to work something out if it's before the mock study section in terms of the assignments and stuff, but we want to make sure we can get those things checked and distributed to the reviewers so they have enough time to do a quality review before the mock study section that will occur in early November. But again, let your small group leader and course directors know. We'll try to keep a list of people who are planning on applying to the AAN CDA this year. Again, we have that on your applications. Just sometimes if people have changed plans and stuff, maybe they weren't when they applied to the course, or maybe they were. Just if there's any switches there. And all right, so at this point, I'm going to. I think if I stop this, I'll stop sharing the screen here and open things up to questions or any other points that any of the other course director or faculty who are on want to make.